And I want to talk with one of our partners. Dr. Katarina Lindley is the president of the Texas chapter of American College of Osteopathic Family Physicians, vice president of the Texas Osteopathic Medical Association. She's the owner of Eagle Medical Center, which is a direct primary care practice, and she's involved with our FlattenTheFear.com campaign. Dr. Lindley, welcome to the Mike Gallagher Show. Got you on Skype. We can our listeners can watch the interview online at mikeonline.com, as well as listen to us. I appreciate you taking time out of your schedule, Doctor, to join us. How are you?
I'm doing great. Thank you for having me.
My pleasure. We've all become data experts, and of course, we don't know what we don't know. We're trying to digest the data because data matters, and we hear a number, for example, that 130. I saw this last night in the news here in Florida, where I live. 173 fatalities in the last 24 hours. 173 daily coronavirus deaths. 173 people lost their lives to COVID-19 in 24 hours. The daily death count that we're all watching closely in Arizona, in Florida, in Ohio, in the Carolinas, in Michigan. I want to play this for you, if you don't mind, Doctor. This morning, there was an expert, a doctor named Rebel Cole on the Today Show. And I want to play this clip for you because this, to me, shows the frustration that we all have about the data that we're given every single day. Here's what this guy says, Dr. Rebel Cole, responding to the question about 173 deaths in a 24-hour period as announced in Florida. Here's what this man said today on NBC's Today Show.
Florida reported 173 fatalities, which is it's high so far. Is that an accurate number?
It's an accurate number, but it's also highly misleading. That only about 14 of those died during the past 24 hours.
So the daily death count, Dr. Lindley, is actually 14, not 173 fatalities. He went on to say, and I don't know why it got clipped so quickly there, but he went on to say that a lot of the other fatalities happened in the weeks before. Is this something that's happening from the data we get from states all over the country?
I believe it is, and it's frustrating for myself as well, because I feel that we don't know what the numbers actually are, and the data is not given the day that you're receiving it. So like you said, they are accumulating data from previous days and counting it as daily death. Right.
I mean, and again, I don't know that this is a bad faith effort. I don't know that this is there's some terrible, nefarious agenda. I just know that when the media breathlessly reports, oh my gosh, 173 deaths today in Florida, and this guy points out, well, no, it's not 173, it's 14 deaths in Florida. I think this is happening in a lot of states. Now, this kind of data is going to go into a decision about what we do about America's schools. Kids, who have been home since March, parents are frustrated about this. Polling data, I don't know if we can believe that. It seems to suggest that most Americans want schools to open. President Trump certainly has said he wants schools to open. Can you give us the latest that we do know about the virus as it relates to young people? Should moms and dads be fearful of their kids returning to school in the fall?
I'm a mom of 5 children, and my children are age 8 to 15, and I feel it's essential for them to go back to school. There are a lot of children who depend on school for their meals, for their emotional and social growth. And all the studies that we've seen so far from Europe, where they're open school, shows that children do not transmit the disease and they don't spread it like adults do. We do have to be a little bit more careful with high school kids, but when it comes to younger kids, all the data shows that it is safe. And I have every intention of sending my kids to school.
Well, let's talk about high school kids for a moment, because I've been watching the data at FlattenTheFear.com. As of July 14th, the fatality rate for people under the age of 20, which is, of course, including the high school age, who contract coronavirus, the fatality rate was 1/5 of 1%. That's more than 100 times smaller than Americans over the age of 60, for example. That's a fact, I think, that and that data is correct, right? I mean, isn't that an important bit of data that every parent should absorb in making the decision about whether to send their kids to school?
For sure. Even now, I'm in Texas, like you said, and most cases that we're seeing in Texas now are younger people. They're probably in their 30s, 40s, and we're seeing some teenagers and things like that. But they all are actually recovering pretty well. And while some teenagers in high school might have some mild symptoms and have COVID and things like that, I think when it comes to them, the mortality rate is so low, there's really no concern. The ones that we would have to protect in that situation would be teachers. And I think that schools can come up with some great ways to protect the vulnerable teachers and give them maybe options to teach their classes off campus and just be streamed into the classrooms, because staying at home is not normal for teenagers. It's not normal for our children. They do need to socialize. They need to bond. This has been very hard for my own children, and I think even CDC has come up with new set of guidelines, and they're saying that risks of opening school is low compared to children spreading the disease, but the risk of keeping them at home and having them suffer through abuse, through not getting different services that they need at school, is going to be very difficult for these children later on to develop normal lives.
Dr. Katarina Lindley is our guest. She's a board-certified family physician. She's part of the Flatten the Fear campaign we've been talking about here on the Mike Gallagher Show. Go to flattenthefear.com and check out the data. Be engaged. Be involved. Final question, Doctor. I really believe that in the decision about opening schools, the American Academy of Pediatricians has a big seat at the table here. And as you said, all of the things that the kids are experiencing right now, being locked down, and not going to school, social isolation, depression, food insecurity, lack of physical activity, ineffective learning, and the American Academy of Pediatricians is encouraging public officials to open the schools. That, to me, is a game changer. How important do you think it is that the American Academy of Pediatricians has weighed in on this?
I have to tell you, I'm a family physician, so I don't belong to that academy, but I was very proud to see that they stood behind the children, that they, even with the fear that, watching TV and from the news, from everyone else, everyone is trying to make us scared, in my opinion, because we have to realize we will never get rid of COVID-19. We have it now, right? It's going to be with us for the rest of our lives. We have to learn how to live with it. We have to learn how to coexist with it. And staying at home is not good for anyone. It's not good for children. This summer has been very hard for children. I actually just saw some teenagers. I saw two teenagers drive in a car, and I was thinking to myself, it's so sad they really don't have anywhere to go, because you're not supposed to go to the movies. You cannot go hang out with your friends. And one thing everyone forgets when it comes to school, I feel that kids and parents are the customers of the school system. And for us just to say, oh, we're not going to open schools because we're scared, we have too many cases. As you can tell, I'm a legal immigrant to the United States, right? This country is country made on American dream. There is nothing that's impossible for Americans. And for us to just say, we're not going to do it, we can't figure this out, I just don't accept that. Because yes, different schools in different areas will have to open differently, and that's fine. Everyone needs to come up with their own plans on how to open. But we always have to keep in mind the people who matter when it comes to school are children and their parents. And many parents, if we don't open the school, I know I've heard this argument, school is not a daycare. Yes, school is not a daycare, but our society is based on the fact that children go to school 8 to 3, and that allows parents to be able to go to work and maybe have after school daycare. If kids don't go to school, parents don't go to work. And economy will never recover from this, no matter how optimistic we are.
Correct. Dr. Lindley, I appreciate so very much your input, your insight, and thank you for participating in the Job Creators Network Foundation's Flatten the Fear campaign. All the best, ma'am. Thank you. Keep fighting the good fight.
Thank you, sir.
Take care. Go to flattenthefear.com.